George had been suffering with significant urinary difficulties for many years. Recently, he came to the practice and he had a procedure done. He's extremely gracious to share his journey with us. So thank you so much, George, for allowing me to interview you.
You're welcome.
So before you came in here, tell us what was going on with your urination.
Well, I had extreme difficulty in sustaining a stream at all. I made a good basketball player because all it was dribble, dribble, dribble.
Had a lot of practice.
A lot of practice, yeah. It was not only difficult physically, but emotionally.
How is that?
It made me feel less of who I knew I was.
Mm.
As you grow up and you're a young person and you're vital and everything works properly, you feel good. But as you age and things start to decline, every little thing that happens to you makes you feel worse.
It adds up, and I think that's like more and more that moral injury
Correct.
to your body, to your senses.
Absolutely.
So what made you decide I've had enough?
Well, I tried a couple of different medications that were supposed to take care of the situation. And I tried them for a couple of months, realized that I didn't have any relief whatsoever. And I heard that you and your staff were excellent at providing different solutions, one of which was the UroLift. So I came in and we had our consultation, and it sounded like a great idea to me. So I went through with the procedure.
So you're saying that you tried two different medications, and they were tadalafil and and tamsulosin, neither of which worked for you. And then you said, okay, this is not working. It's time to look for a different solution. And then you came and found us. Now, before I did any sort of surgery like a UroLift on you, tell us about the workup. What did we do before I did that procedure?
Well, we went through a series of different examinations to make sure that I was in sufficient physical condition to go through the procedure. And it was explained to me probably in more detail than I wanted to know.
Sure.
And he also did an examination internally to make sure that everything was proper and that possibility of success was high.
Yeah. So I always want to make sure that whatever I do gives you the best chance of success in reaching the goal that you want. Easier urination, less basketball practice with dribbling. And what we did was I measured your bladder function using a UroCuff procedure. I looked into the bladder with a small telescope called cystoscopy, and I measured the size of your prostate with a transrectal ultrasound. We came to the conclusion that here are the treatment options, and we decided UroLift might be a good option. So you had this done several weeks ago. How was the procedure, first of all, and we'll go from there.
Well, the procedure was relatively simple for me. I came in, voided my bladder, went into the procedure room, met the staff. I got a mild sedative, so I wouldn't freak out. and before I knew it, the procedure was over.
Did you recall? Do you remember the procedure?
No, I don't.
Yeah, we provide IV sedation in the office, and anesthesiologist came in, started an IV on you, gave you that medication. So you don't remember a thing, you don't feel a thing.
That's correct. All I remember is a bunch of wonderful people standing before me and sitting up and being told I could dress and
That was it.
and leave.
Yeah. Now, how was your recovery? This is a very important thing. A lot of people are worried about recovery from any sort of procedure.
My recovery was really simple. I was, I guess, not surprised, but very pleased. I was given a dye to take, which provided some relief from any pain that might occur. And after 2.5 days, I was recovered. I was able to void my bladder completely, no more basketball, and it's just been wonderful ever since. Before the UroLift, there were times that I would have to get up 2, maybe 3 times during the night to urinate. At least I had the feeling that I had to urinate. Sometimes I did, sometimes I didn't.
Mm.
But after 3 days, well, I was on my way. There was no problem sleeping all night and having a wonderful, restful sleep.
Sounds like you had a pretty easy procedure and you had a very short recovery.
That's correct. Yeah. Actually, the procedure was easier than I had thought it might be, and recovery was much faster.
So, how are you voiding now compared to before you came into the office?
Now it's whenever I have the inclination that my bladder is full, I'll go to the restroom and completely void my bladder. So instead of going to the bathroom, I would say up to 10 times per day, it's 3 or 4.
Now, that can vary depending on what you drink, but on average, about 7 times a day. A typical person voids about 7 times a day. I also checked today with an ultrasound, and you did empty your bladder today. So
Right.
not only do you feel like you're emptying, you truly are emptying your bladder.
That's wonderful.
One last question.
Sure.
How has undergoing this procedure, the UroLift procedure, changed your quality of life?
Oh, immensely. To be real honest with you, I'm a 74-year-old male, and it makes me feel 50 again.
That's great.
I mean, I cannot say anything more positive about the UroLift than sharing my experience. It was just wonderful.
What would you tell guys who are on the fence regarding their urinary difficulties?
Oh, if one of the options you have is the UroLift, then I sincerely urge you to get tested. And if it's determined that you're a viable patient, please go through with the procedure. It's wonderful, life changing.
George, thank you so much for sharing your story.
You're welcome.